This is time to prepare for cold winter. You can start by signing up for Government of Canada's weather alerts so you can receive when the winter storms or really cold periods will be coming. Then you can also winterize your home by cleaning out the gutters, insulate your walls, and make sure to install a carbon monoxide detector with a Canadian certification mark. Finally, you can also prepare for eventual power outages by having an emergency kit that can last you for above a week. I would start to make sure that you're properly dressed before you're going out. So make sure you dress up in layers that is not too tightly fitting. And you can also have an outer layer that can shelter you from the wind or from the rain. Make sure you wear mittens, they're better than gloves. And also to have good boots that are waterproof with wool socks that can keep your feet dry. Then if you're going to the outdoors for a very long time, you can pack an emergency kit with you and also make sure you know where to find shelter and warming centers before you're heading out. Make sure you do drink water to stay hydrated and eat a lot of food. This can help you to keep the heat, and try to avoid smoking tobacco, drinking coffee or alcohol beverages because they can dissipate the heat quicker. Always make sure that you speak with your physician before you're heading out to the cold to make sure that you don't have any medical conditions that can make you more at risk for cold injuries. I will separate the cold injuries into two categories. Ones that happens even above 0 degrees, especially in very wet conditions. For example, chilblains and trench foot. Chilblains is an inflammation of your skin when it's exposed to cold. You can see red or purple change in color. They can be protected if you wear gloves before exposing yourself to the cold another time. It can heal on its own. Trench foot is when your feet, for example, are wet for 2 or 3 days in a row and they start to have injuries happening to them. They can be reversible if you come warm up, and if you see blistering happening and get them treated, then you could prevent permanent damages. The more serious injuries are what we call frostbite and also hypothermia. They mostly happen when the temperatures drop below 0. Frostbite is when your exposed body part to the cold is frozen in the cold, and this can cause permanent damage to your body part. You may see the skin change color to white, a little bit firm and waxy to touch. You may have difficulty moving them or feeling very clumsy or even feeling numb. It's time to go to seek medical care immediately to get this body part warm up and treat it. In very severe cases, you may see blister forming in the exposed body part, or even it can turn black. Again, seek immediate medical attention as it can be limb-threatening. Finally, for hypothermia, it's when you're so cold that your body cannot keep the temperature for its own. It can be a life-threatening condition. The milder ones, you may be shivering very hard, a little bit difficult to walk around, feeling a bit confused. It's time to move indoors immediately and get warm up. For the more severe cases, you may feel sleepy, difficulty breathing, or if someone is observing you, they may see you're perhaps falling asleep or becoming unconscious, then this is an absolutely emergency situation. You need to call 911. We can warm up by seeking warm shelters, going indoors immediately, remove any wet clothing that you have, and warm yourself into a warm blanket. You can also warm the cold parts with your own body heat or do skin to skin with someone else. You can also make sure that you can keep your muscle moving to generate heat, and try to not fight shivering because this is how your body tries to generate heat for itself. You can have some warm non-alcoholic beverages, or if you feel that you need medical help, then do not hesitate. People who are most at risk for cold injuries are young infants below 1 year old, or children who spend a lot of time playing outdoors, or elderly who may wander in the streets if they have dementia, for example. You can also have people who have medical conditions or taking medication that dysregulate their capacity to regulate body temperature, so make sure you speak with your physician. And finally, people who spend a lot of time outdoors, for example, workers who work in the cold, or people who does recreational activities, or people who are underhoused. Warming centers are emergency warming spaces for winter that can be opened by First Nations or your local governments. Sometimes or often they are listed into your band or municipality's website, or you can also find emergency winter response shelters or temporary winter shelters that are opened by BC Housing, operated by a local community on BC Housing's website. For the warming spaces, you can also find them on emergencymanagementmap.bc.ca. This is where you can find the locations of those warming centers. In case of doubt, call your band or your local government to ask for more information.